All right. Sorry about that. So welcome to Spotlight on Innovation. To our colleagues here on campus and to our colleagues in Edgeland, today we are pleased to have with us a friend and a fellow Gator, Mr. Bruce Brandis. Bruce has joined us from a company called Valence Health, but it's not just where Bruce works that's so important for us as innovators, but it's what Bruce does in the innovation realm. So please keep that in mind as you start to think about your questions here online, and for Edgers as you're thinking about, well, how does a talent like Bruce Brandis, what can he bring to us? It's especially appropriate, Bruce, that you're here with us today, because Bruce understands disruptive innovation. And today's lecture after the Spotlight on Innovation has to deal with disruptive innovation. So Bruce Brandis of Gator, welcome back home.
Thank you. It is great to be here.
Good to have you back. Bruce has participated in the Spotlight on Innovation in the past, and I can assure you that what you're getting here is absolute news from the field. And bringing it back to us and to see it live. Bruce happens to live and work out of Nashville, Tennessee, which is a hotbed for entrepreneurship and innovation. It's no longer just the music capital of the world.
Actually, healthcare is the largest industry in Nashville. Although it's Music City, the reality is the economic impact from healthcare in Nashville is infinitely larger than country music.
Wonderful. Do you happen to sing any country songs?
You don't want me to sing.
All right. Well, I tried, but all right. Bruce, as we have in the past, and as you know, and we've even talked about this kind of in prepping you, we start with this one question. What is your definition of innovation?
Well, considering I had no preparation for this except for that one question, I don't want to come across with a rehearsed answer, but it did cause for me to reflect on how do I define innovation, and it's a pretty simple definition in my mind. It's having the vision and inspiration to see a problem that needs to be fixed or could make a situation or an opportunity better and figure out how to solve that problem in a way that hasn't been solved before.
So a question, how does one acquire or perfect vision?
That's a great question. And I would say that most importantly to understanding a problem is really to put yourself in the shoes and to surround yourself with people who are very close to the problem. And so in any business that I've been part of, and it's all been healthcare, but at the end of the day, before I ever think to innovate, I really have to understand what my customers are experiencing. And it's also important to observe that they may not know what their problem is. They just know this is the current state on how we do things. They may not yet see it as a problem, or they may not have thought of there could be a better way of doing this. So in reality, it's really just asking a lot of really good questions of the right people and observing and thinking, and then asking more questions and vetting out your ideas so that you don't just have an idea in a vacuum, but it's really something that's been vetted properly before you go too far in trying to decide if it's really a good idea that could be commercialized.
As was mentioned to start, Mr. Brandis and I have not rehearsed anything. But you'll notice that Bruce mentioned a couple things that have been very much a part of our innovation journey. Understanding the customer's needs and then also getting feedback from the customer. Observing. Asking lots of questions, and I might add asking lots of open-ended questions.
Absolutely.
And then continuing that process of learning more and delving deeper and failing. Because failure is a part of the innovation success story.
I don't know very many innovative people who had it right the first time, or even the second or third time in many cases.
We were laughing about everybody, at least the younger generation thinks that Elon Musk is the baddest of the badasses. Well, we kind of think he's pretty badass too. But he fails all the time. What's to prevent you from taking on that role? Nothing. He follows the Art Williams script. We have a video that we watch by Art Williams, and he just says, just do it. That's all it takes. Your career has been a series of successes, But it seems
with some failures
with some
too.
failures. But it seems that there was this overriding approach that you took was just like, I'm just going to do it.
Well, I'll make a couple observations. One, the reason I'm in healthcare is because I'm very passionate about that healthcare is very broken, and I put myself as a patient or someone who I love as a patient in the system and just see how fundamentally flawed it is. And then combine that with the fact that it's really the most significant drag on the potential growth of our economy in the future if we don't radically change the paradigm around which the economics work with healthcare, not to mention the fact that the clinical outcomes aren't acceptable. So the reason I'm in healthcare is because I'm passionate about solving problems in healthcare. The other point I'd like to make is, and I was flattered by your introduction, but in truth, I don't necessarily see myself as an innovator. What I'm really probably best at is surrounding myself with really smart people and finding the people who really are the innovators. And one of the reasons I really appreciate this opportunity to work with engineers is I think the best ideas that will solve the next generation of problems are coming from people in this room and people across the country in your position that are engineers. It's not, I was a finance major, and my first job out of school was with IBM as a sales guy. And so I wasn't solving anybody's problems. But what I quickly learned was to associate myself with the people who, while I could see what the problems were, I couldn't come up with the ideas on how to solve them. But I found the people who could. And in many cases, those people are smart engineers who were close to a particular problem. And what they lacked in some cases was the business side of it. Okay, I have a great idea, but how do we scale that and develop that into a business that somebody's willing to pay money for that can get market traction? And so where I found my success is not necessarily being the innovator, but to help the innovators to scale a company into a sustainable business.
And by that approach, you have been able to scratch the pioneer spirit that you have, because healthcare today, believe it or not, heavily regulated industry, is where the pioneers are. Ernesto asked this question, which is very germane for healthcare. Does or will the Affordable Care Act benefit or constrain the healthcare industry?
That's a great question. So the truth is, first of all, there's such a lack of knowledge about what is the Affordable Care Act and what is Obamacare, because it's funny, if you take a general poll of people, what do you think of Obamacare? Everyone hates it. But what do you think of the Affordable Care Act? Everyone thinks really positively about it. Fortunately, I see from the smiles of folks in this room, no, it's the same thing. and so our point of view is, and I think that this is generally true of the industry, is it has to change. And whether Obamacare, Affordable Care Act, whatever you want to call it, came along or not, there was going to be meaningful change in the industry. In a lot of ways, this just helps accelerate and maybe focus some of the change, and it gets the conversation top of mind. I think the immediate effects of Obamacare, aside from the obvious distraction in D.C., and I won't comment on that, but what you're going to see is a large percentage of probably 30, 40 million new patients getting infused into the healthcare system who weren't there before. So in an environment that already had too few doctors, there's a significant physician shortage in this country. And when you put another 40 million patients into the system who are aging with more and more chronic diseases and complexity to care for those patients with too few doctors, something has to radically change, because the way in which we've always done healthcare can't work under 40 million new patients getting infused in. And so Obamacare is one way of potentially addressing the problem. I think what's going to happen, like any other time major shifts happen in an industry, it's not going to be directly where you'll point to, okay, it was the Affordable Care Act and how it was enacted, but it'll be the ripple effect of what comes next, which is still evolving, but that will have been the trigger event that precipitated a lot of the change.
Just by a show of hands, who, before Mr. Brandis mentioned the 30 to 40 million new patients in the industry, who knew that was the influx who knew that? Good. I did not know that. Talk about an opportunity. My goodness. Because now Bruce is not the architect of the current healthcare delivery system, and some of you are participants in that, but that's broken as it is, isn't it? If it isn't broken, it's definitely sputtering.
It's very broken, and we're about to put a whole lot more volume through a broken system.
Engineers, calling all engineers. Forget about solving the world's problems. Let's just solve our own healthcare problem right here at home.
Absolutely. And what's really interesting, when I look back over the 25 years of my career, I've seen major companies that have been very successful in other industries that have seen the dollar signs in healthcare. And this goes back to the late 80s when I first started in healthcare. You'd see companies like McDonnell Douglas and American Express that saw, wow, look at what's going on in healthcare. We have smart engineers. We can solve these problems. And what I've seen is that they get in, and then they realize healthcare is not like other industries, and it's really screwed up. Not just that it's really screwed up, but fundamentally, the fundamental basis on which decisions are made is different than it would be with rational business choices that you would make in manufacturing or retail or finance. And so they get frustrated, and they've invested, and then they've divested of their healthcare portfolios. And I think a lot of that has to do with historically, with healthcare, where it's not really about making money. It is, because we have to perpetuate the system, but it's about life and death. It's about wellness. It's about, so the hard facts of making business decisions when you put the human face on healthcare makes it very different. And if you ask a doctor what they went to medical school for, they may tell you that it's a comfortable living, but most doctors and nurses went into healthcare because they really want to help people. And that's a little bit different than the profit motive that you might have in other industries.
Matt asked this question, really staying with the broken healthcare system. And Matt, thank you for this one. What role, and I'm not just going to limit this to Bruce, but what role does grit play in changing the broken healthcare system? And by grit, that means rolling up the sleeves and just making it happen.
Well, I think grit has to be part of making anything that's hard to change better. I would say that, yes, that's absolutely part of it. In healthcare, my observation is, and one of the reasons why I'm at Valence Health now, is because the fundamental misalignment in the industry, and the reason the problem's been perpetuated for so many years, is the underlying economic model is fundamentally flawed, where if you think about it, doctors and hospitals get paid for something that's different than what your incentives are as a patient or your employer who might cover your health insurance is. A doctor or a hospital historically gets paid for you to come back to their hospital, right? And for you to stay there as long as possible. It's a fee-for-service model. So if their incentives are to make sure that they heal you enough that you don't die, because if you're dead, you can't pay. But they also don't want you to be completely fit and well, because if you never have to come see them, they're not making any money on a fee-for-service model that way. So we're actually now, and this is accelerated by the Affordable Care Act, but it was kind of happening anyway, but what really has to happen, and is starting to happen, is instead of a fee-for-service, to fee-for-value, and ultimately a value-based care model where we're getting paid for outcomes and paid for keeping the population healthy. And you're going to start to see shifts in the way doctors and hospitals get reimbursed, in the way they think about preventative care, the way they think about chronic disease management. And that at the core has been why this industry has been so slow to change. And so no matter how much grit you might have had, until that incentive for doing the right thing gets fixed and people are aligned, it doesn't matter how much grit you have. I'll give an example. One of the companies that I advise, that I used to be responsible for strategy for, Airstrip Technologies, is a very high-tech mobility company that leverages smartphones and tablets to change the paradigm of healthcare. And we could quantify and show how we could reduce length of stay, we could reduce readmissions for a cardiac patient. Those are all things that if you're the patient or you're the person paying the bill, you would absolutely, if someone has a heart attack, I want to go home as quickly as possible, and I don't want to have to come back. Well, depending on, if you're the hospital, depending on the payer and depending on the market in which you are and the arrangements you have, if you implemented technologies like that truly are game changers for improving outcomes, you actually might be costing yourself money even if the technology was free, because you're getting paid to have heads in those beds, not to keep them out of the hospital. So that's a perfect example of how the paradigm has to shift to have everybody's incentives aligned to do the right thing.
Is everybody pointed in the right direction so that the paradigm shift can occur? Or is it theoretically nice to have, but it's going to be impossible to achieve?
Well, that's been the $64,000 question for the last 25 years, and we've had grumblings of change in healthcare, and it's never happened. And I would contend the reason it's never happened is we've never hit the tipping point that we are today, where healthcare is now approaching 18%, projected to be 20% of GDP. It's unsustainable the way it is. So that, combined with the fact that the underlying technology and data that needs to be available to do true population health has never really been massively available until today. Mm-hmm. So I think we finally hit that point where the change will happen.
RJ asked this question: much of the reason America, and this is his opinion, so much of the reason American healthcare is broken is rent-seeking behavior by all parties involved: the doctors, the hospitals, the insurance companies. How can you innovate how can you innovate or bring costs down and efficiencies up in such an inconducive environment?
Well, so that's a great point, and that's part of the fundamental shift that's changing. Our belief at my company, which is one of the reasons I joined, because it's fundamentally, culturally, and philosophically aligned with what I believe, is that at the end of the day, if healthcare is going to change, providers, the doctors, need to be in charge of how healthcare decisions get made. And as opposed to the traditional payers, the Uniteds, the Aetnas of the world, they have a different incentive than do the physicians who went to medical school to keep people well. And our belief is, for physicians to thrive and survive and to be in control of how healthcare decisions get made, they need to be at risk financially so that they are rewarded for doing the right thing and providing better quality care. Under today's model, historically, I would classify the traditional insurance payers as the dark side. Mm-hmm. And there's opportunity for traditional providers to become the payers and obviate the need for the health insurance market as we historically have known it. And back to the Affordable Care Act, these exchanges, the state exchanges and the federal exchange, is a way to help to do that. And you're seeing the big 800-pound gorillas in the Uniteds and Aetnas diversifying their portfolio to get into population health and actually rebranding themselves. There's a division of United that's called Optum. There's a division of Aetna called Healthogen. And because they know that people know they're the dark side, so they're trying to hide a little bit. So I would say that the way it gets fixed is probably by radically changing who's in charge of how healthcare decisions get made.
Well, that's a great segue to the question that Christopher asks, which is, failure in most industry usually leads to financial demise. In the medical industry, failed innovations can lead to health risks and even death. How does this risk affect the innovation process?
That's a great question. Well, Whit had mentioned that healthcare is a heavily regulated industry, and that's the reason it's heavily regulated by the FDA and other organizations, to make sure that patient safety is first and foremost. I'll give an example. That when I was with Airstrip is a very innovative company. The fundamental premise of what the company did was it takes clinical information that's generally tethered to the patient's bedside on a monitor, the squiggly lines that you're hooked up to, that normally the doctor has to be at the bedside to see what's going on, or if they're away from the bedside, which is most of the time, they would rely on a nurse to verbally describe something that they're really supposed to visually interpret. And so you can see the inefficiencies and potential problems there. Well, a smart engineer, Trey Moore, who co-founded Airstrip with a physician, the idea was, how can we take that information and stream it real time to a smartphone so a doctor anytime, anywhere can see exactly what they need to see without a geographical boundary restricting it? Well, as you can imagine, that has a patient safety implication if that technology is flawed. And we know that there are bad cell phone connections. They're just fraught with problems. And back, this was a company started in 2004, 2005, so think about where mobility was then, pre-iPhone. They had the vision to know that it was a problem that needed to be solved, but wanted to find a way to solve it that was betting on some things to happen in the future. One of the other things that we bet on at the time was that we submitted to the FDA to regulate and clear our technology before anybody else was doing this. So in truth, we didn't have to do that because the FDA hadn't yet come out and said, hey, when you're using a mobile phone to monitor a patient, because nobody had conceived that that could even be. But we actually submitted to the regulation because first and foremost, it was about safe outcomes for the patient, improving outcomes, and we couldn't do that if we couldn't demonstrate that this was safer for the patient, reliable. And so it probably took us a couple more years to get to market because of that. What, in hindsight, once we cleared that hurdle, we set a bar for all the competitors that came behind us, as well as we had a number of patents and other things that were barriers to entry. But submitting to the FDA was a great way to make sure that everyone else who came in behind us to that market had to adhere to those quality standards to make sure that first and foremost it was about patient care. And if we failed and we didn't do it right, it would never come to market to be at a place that it could be at risk. So it definitely limits innovation from the perspective of that probably scares a lot of other innovative folks away from trying to do this because they know that it's heavily regulated. But if you persevere through it, the outcome can be much better.
What does it feel like being a standard bearer in an industry that is probably hidebound on conventional approaches? And are you thought of as the rebels?
You know, in some ways, I'll tie it back. Timing is everything. So yes, we were seen as the rebels, but we were fortunate enough at Airstrip to be able to ride the Apple wave as the iPhone was introduced, as we basically hedged all our bets once the iPhone was announced to put things to the iPhone. And Apple featured us very prominently at, we were on the keynote stage at Worldwide Developers Conference behind Steve Jobs. We were featured in several of the iPad commercials. And so, we were fortunate. If we had been too early, we would have missed that, and then yes, it would have been detrimental. But we were fortunate in having good timing that it reflected well on us being the pioneers. But it was risky because if it had happened at a different time and we didn't have the Apple momentum to ride, I don't know that we would have had the same level of success. I'm certain we wouldn't have.
Your sense of timing for Valence Health is solid, yeah? I mean, you're just in case you haven't seen what Valence does, helps healthcare providers better manage their patient populations and accept financial responsibility for the quality of the care they provide. You know, it strikes me, and please remember that Bruce serves as an entrepreneur in residence in the College of Business here at UF, and I say that I'm in this customer service business. You would hear the same comment from Bruce.
Absolutely.
Understands that healthcare is all about patient service. Education is all about student service, up to a point. With unique data collection and analysis tools, Valence Health has emerged as a leader in population management and administering provider-sponsored health plans, which is a very nice segue into Heidi's question, which is, how is this new healthcare system going to be effective with the influx of the 30 to 40 million new patients coming in? You have the old patients still in the mix. They're probably not too happy right now as clients or customers. What's going to happen?
Well, it's happening now, and it's actually creating a lot of great entrepreneurial opportunities. And it's one of the reasons why you see so many folks getting into healthcare now. So you've already seen the advent. You all may be using this system, but if you have to go for primary care, traditionally a lot of people would just show up in the emergency room and so there's a bottleneck in the emergency room. It's obviously not the most appropriate place for you to go unless you really need emergency care. You've seen a whole advent of the minute clinics, the little clinics, and the other things that you see in the Walgreens and CVS pharmacies and in the grocery stores. You're going to start to see more and more community ambulatory clinics and urgent care centers, so that'll be out in the community so that folks don't have to go so far to get primary care. You'll see, because we have not enough doctors, you're going to see nurse practitioners and physician assistants being that first level of triage for those things that really aren't emergent. care. The other thing that you'll see, and we're seeing today, is with 40 million new patients, you can't have all those people in the hospital. You have to make it so that it used to be that you would stay in the hospital a long time and there was a subset of the beds that were monitored beds for high acuity patients. Well, in truth, if you're not sick enough that you need to be in a high acuity bed, meaning one where you're hooked up to all the sensors, where you're probably not going to be in a hospital. You're going to be in some other venue of care. And if you have a chronic disease where you're probably much more likely to need the healthcare system, of these 40 million new patients coming in, plus most Americans, I think 70% of Americans have at least one chronic disease, 30 or 40% have two chronic diseases. And so the truth is, there are technologies that are being invented now, Airstrip being one of them, with body sensors and other things that can allow us to proactively monitor those high-risk patient populations from home or from wherever, and you'll hear the term patient-centered medical home. There's going to be a lot more where we proactively watch out for those patients before a sentinel event happens, so that would send them to the emergency room. And we'll get better at that. But the first thing we have to do before any of those things can make a difference is align the financial incentives for all those folks so that the providers, as margins are thin now for hospitals and it's hard for them to predict, we have to shore up the system so that they can be financially viable. And they also have to get the efficiency out of their own internal processes at the same time.
Wow. Seems like it's a mess.
It's been a mess for a long time. It's just people are now noticing.
Been a mess. Well, let's Clayton asked this question. It has nothing to do with sort of the dire situation of healthcare, but I love the approach here. Thank you, Clayton. Have you thought about combining music and the healthcare industry? The reason thinking is music, most music comforts most people. Maybe there's a musical treatment to cure or help people.
Somewhere in there is an entrepreneurial idea that you can explore making a business.
See, one of the things we've talked about in our journey is to find disparate components and put them together. And we all laugh about it. Well, why would you? Well, somebody put a suitcase on wheels, and they put those together. Someone put a clock and a bell together, and the bane of everybody who's woken up with an alarm clock. So why not combine music and healthcare?
My only request is when you start that company, do it in Nashville.
There you go. Yeah. Yeah, exactly right. Please don't write too small here. My eyes are... I'm not that bad here, but I'm going to go back to Bruce's career. You have one of the coolest titles, Executive Vice President in charge of growth and innovation. Love it. So if I walk down the hall and say, hey, Bruce, how's it going today? And where are we on the innovation curve? You say, wait, get out of my office? Or do you say, no, I can show you right here?
Let me give you my thought on titles. First of all, my joining the company is a newly created role, and that title was completely made up.
What title did you want?
No, that was the one I wanted. I came up with
exactly.
But what it really means is, I don't like the word sales. I think the word sales, in the way in which it's understood in the market, has a negative connotation of some guy in a cheap suit trying to sell me something that I don't need. And so I never liked that term. My first job out of business school was with IBM. Actually, IBM didn't use the word sales. We referred to it as marketing. I was a marketing rep. And I think the delineation and the sensitivity I've always had to that is someone who's in sales is looking out for their commission and their own self-interest. What I was passionate about, understanding that I was going into sales, what I was passionate about was solving a problem for a customer. And I didn't want to get lumped in with other people who give sales a bad name. And so throughout my career, I've had a sensitivity to what is it really that we're trying to do, and what am I really responsible for? Yes, ultimately it's about sales, but sales is a byproduct of helping to figure out how the best way is for us to grow our company. So growth really means sales, but it also means other things too. But at the end of the day, it's about how do we grow what we do, grow the business, grow the value proposition for our clients. So it's much broader than making a sale. But sales is part of it. And the innovation side really points to its growth and innovation are completely intertwined. You can't grow unless you're innovating. And if you're innovating, you have to figure out how to use that to grow the business. Otherwise, if you're not successful in growing the business, you don't get the resources that you need to continually innovate.
And this is from the company's press release. Bruce leads initiatives that accelerate Valence Health's rapid growth through innovation and engineering. Again, that's from the company's point of view. And I think that is a tremendous opportunity for us innovative engineers. Daniel asked this question. It seems that up to this point, I think that's fair to say up to this point, innovation in healthcare opposes the disruptive innovation model. Arguable, but let's just say, what processes would you follow going forward in order to fully integrate the disruptive innovation model in healthcare? And now, there are other examples where we've seen industries disrupted by innovation. So telecommunications, personal computing, financial services, believe it or not, it seems like it's such a staid old industry. Financial disintermediation completely rocked that world 15 to 20 years ago. We're suffering from some of the things that have resulted, but financial disintermediation occurred rapidly in there. So what would you forecast of disruptions or continued disruptions in healthcare that will create real paradigm shifts in the industry?
Well, I agree with the premise that there hasn't been a big bang disruption that's changed healthcare. I would contend that it's not a technology that's going to do that. It's actually the underlying economic issue, as I've shared before. I think that creates the paradigm shift that will enable other things to start to make a difference.
Just on this, because this is sometimes a real cloudy issue. The economics of healthcare are pretty interesting because you have a payer, a provider, and then you have the patient. I call them the 3 Ps. Yeah? So it's not just that I walk in there and I say, I'd like a bottle of water and I'm going to pay the water company for that bottle. If I want to have a heart stent inserted in my chest, I don't really get a chance to shop around for that, do I?
Well, not if it's something that's urgent, although you'll be able, part of the transparency that comes with the new legislation is the fact that you actually do have more information from which to make a decision on where you want to go for your care. That said, there are a whole lot of implications from that.
But so how are we going to look? So we use those examples. Technology has grown across the board and has created such shifts the way we do things. Who buys a car, new or used today, without having so much information at their fingertips that they walk in and they say to the dealer, you're going to make $50 on this car if you sell it to me for this. And the dealer says, more like 45. But you're right.
Well, and actually, one of the reasons why the fundamental economic model has to shift in healthcare is, think about any other industry where historically you would go to the hospital or doctor and give them a card that says, these people will pay for me. Treat me on faith that these people will pay you whatever it is that they'll pay you. And you'll find out in 30 or 60 or 90 days how much you're going to get, and I'll long since been gone. Thank you very much for the care. Well, about 50 cents on the dollar from what a hospital charges gets collected. 50 cents on the dollar. Imagine any other business that can survive on that. So the 40 million people getting infused in the healthcare system, a lot of them are already in the system. They just come in and get free care and leave, and the hospital or the doctor has to write it off. So that's something that will start to be addressed with everybody having some level of insurance. And at the end of the day, the industry just has to change.
trying to read. Enrique, I'm sorry, I can't get my eyes to focus there on that one. I'm sure it was a great question. Let's see.
Oh, the other point I wanted to make on the whole payment model, the other change that you're seeing, and you guys may start experiencing this, is a lot of the financial burden is now being shifted to the patient, where you're feeling the economic pinch, where you have a much higher deductible that has to be met, where it's out of pocket for you before insurance kicks in, or what your copay will be. And so that's actually changing a lot of behavior, and I see it in my own family. When my wife wants to go to the doctor because the kid has the sniffles, well, it used to be, let's go, it's $10, no big deal. Well, now we're paying the first $5,000 of all the health care that we incur. So you kind of do a gut check. Well, let's give it a day and see if the fever goes down with some Tylenol first.
Right. Yeah. Jorge asked this question. I think this is very interesting. Help me on my memory, class. Did we watch the video of the TED Talk with the guy with the glasses? We didn't do that yet. Okay. Did we see that one? No, not yet.
So with Google
okay.
Glass? Or?
Sorry. No, okay. No. But Jorge asked this question about how do we address the potential doctor shortage with so many new people coming in requiring patient care?
Yeah. One of the other hot areas in healthcare right now is reinventing telemedicine, to be able to allow a physician who may have domain expertise to not have to be at one physical location to care for that patient, but to leverage technology, including mobility, for a cardiologist who might be in New York City to consult on a case in Topeka, Kansas, leveraging technology to be able to do that. And you're going to see more and more of that, which allows, again, to leverage the doctor's time and expertise to be working more efficiently on the cases that that particular specialist needs to focus on, and leaving the more routine stuff to people who can do it.
Just by a show of hands, is anybody involved in telemedicine on the research side, or maybe have had experience in it? Huge area. And you're kidding yourself if you don't think that telemedicine is going to play more and more of a role in your healthcare. No doubt about it. Bruce, let's make a little shift here. Student questions, you, as always, come down to guide us in the ways in which you know. So a best practices approach, we use this all the time in the course. So from a best practices standpoint, how did you drive your career to be that in a position of an innovative leader? Or how do you, if you're starting your career or advancing it, how do you position yourself towards innovation and align yourself with what's happening in an innovative part of your company?
Yeah,
do they have a volunteer day on innovation once a year?
Well, some of it is, like I mentioned earlier, find your passion. I told you my passion was healthcare. Figure out what your passion is, and it's not just a job for you, but it's something that you truly believe in and care about. And whatever organization you're with, or the folks in the industry with whom you might network, will sense your passion. And it's a whole lot different for you to get to a place where you can have the opportunity to be innovative if it's something that you really care about. So think about what that is for you and focus on it, and then build out a network. One of the things that I was fortunate early in my career, I got lucky. The first job I got out of school with IBM was just because I so happened to mention to a friend whose mother overheard me rattle the names of companies that I blindly sent resumes to and hadn't heard back from any of them. And her mother happened to have heard me say IBM, and she yells to her husband, "Hey, does this guy still work at IBM?" And the next thing I know, I had an interview. And so completely unexpected. And my IBM experience is what just so happened to put me on this career path. And so I would tell you, network, that the most important thing you can do while you're in school is build out your network, because think about people you know or people who you potentially can get access to. I mean, LinkedIn I find is a very useful tool to connect with folks. And that is an effective way of finding your way in. And then once you're in, I think it's to innovate you and to position yourself as an innovator. you have to get really, really close to the core of whatever the problem is your organization is trying to solve and become an indispensable part of understanding the problem and figuring out who the right people are in your organization, if it's a larger organization, who will listen and add value to them, recognizing that you're not going to be CEO of the company day one. You're going to have to earn your right with good ideas and demonstrate to folks that you are worthy of more and more responsibility and trust, but get close to understanding the problem and come up with ideas. And again, back to the point, fail fast. Come up with lots of bad ideas and understand why they were bad ideas and they didn't work, and then come up with the next idea.
Bruce, you mentioned it, we talked about it before the session, about understanding what business you're in and then being very clear to know what business you're not in. What business is Valence Health in?
At the core, we're in the business of helping providers to be in charge of their own destiny as it relates to the future of healthcare. Okay. So if a health system, and we by the way sell our solutions to hospitals and providers, we don't work with payers, and we purposefully work with them in a way that if they want to be successful in going from fee-for-service to value-based care, we are narrowly focused on being their strategic partner to do that and having the roadmap in terms of technology-enabled services to help them to be successful on that path.
What business is Valence not in?
Well, that's a great question, because in truth, if I define ourselves very broadly of here's what we do, we can help you to go from fee-for-service to value-based care, there are a lot of things that we don't do that really are part of that journey. But what we have to be able to do is define for our clients what's core to the mission and what are we really good at, and then what is either core to the mission that someone else is already really good at that we don't want to reinvent the wheel and we'll partner or bring them in, or what else is really not core to the mission would be a distraction. And so we make deliberate decisions on a market-by-market basis as to what products we should be in and not be in.
Mm-hmm. You spoke about the network and your personal path and your career. And Rachel asked this question, what do you consider your greatest success regarding innovation? And how did either you or your colleagues, your team members, come up with that idea?
So I would say my greatest strength is surrounding myself and finding really smart people who are the innovators. I mean that sincerely, and certainly anybody who has worked with me is chuckling when you keep calling me an innovator, because they would probably say, yeah, maybe a little bit, but it's really the smart engineers or physicians or other people that I've worked with that had an idea to start a company that were the innovators. Where I helped was to figure out how to take their idea or the foundation of their business and scale it rapidly through growth. And actually, I found my niche. If you look at my resume, I can't hold a job for more than 3 to 5 years. and in truth, I've had a couple that lasted less than a year when I realized it wasn't a fit. But what I've realized is I'm not the guy to come up with the idea to start the company. And I'm also not the guy, once the company's grown to a certain level, to be part of a mature bureaucratic environment. I can't do that too well. So what I do is I find those innovative folks that I can help to scale their idea and their business to commercial success rapidly. And then once it gets to a certain level of maturity, it's sometimes time either through an exit or to go back and try it again. And so I would tell you the secret of my success is I've been fortunate to be, I understand the problems of healthcare, I think, fairly well. And I think I have been a good judge of assessing what ideas don't have great commercial opportunity and which ones really do have commercial opportunity and, more importantly, can move the needle on improving the healthcare system and outcomes, and to surround myself with those really smart folks.
And just to remember, when Bruce speaks of scale, that's in the same neighborhood as execution, okay? So remember, our innovation equation is alive and well, and it's doing well, extremely well in Mr. Brands' world. To continue on with Rachel's, what was your personal, or what idea, what concept, success or failure, makes you laugh or smile or cry today still?
What idea success or failure? Well, the pet rock, if anybody was a child of the 70s.
How about anything that you might have been involved in?
Gosh, that's one I have to think about because there are probably a number of them, but let's circle back to that one.
Okay, we'll come back to that.
I'll think while we're...
Let's see here. Tim asks, how will patient responsibility become part of the core healthcare economic model? I'm like, wow, don't hold your breath on that one, but
well,
fitness, diet.
Here's one, I hate to indict all of America, but
oh no, we're indictable.
I would say that the average American is happy being fat and stupid and and if we perpetuate a system that allows them to continue to be fat and stupid.
Hold nothing back there, Bruce.
Well,
no, how about
I
this?
love America.
How about this? Unhealthy. The Americans are unhealthy.
Yeah.
There's no sense of finding. Think about it. Our lifestyle is unhealthy, and that doesn't just mean whether it's weight or vices or something like that. We do not lead a healthy lifestyle. It's not a sustainable lifestyle. So that's really the bigger question. And to be fair, if the future of healthcare requires a healthier lifestyle, doesn't it all start with us?
Well, it does, and I think that what we discussed earlier about patients having to take financial responsibility for a greater portion of their health care will, and honestly, when you go to get car insurance, if you have a bunch of tickets and you're in an accident and you're a bad driver, you're going to pay more than someone who has proven to be responsible. And so I think we'll start to get to some form of, and again, if you have a pre-existing condition, that's one thing, but if you choose to be obese, and again, I don't mean to say it that way because I know that there are other conditions that lead to that.
If for some reason you have the outcomes of a healthy life,
but if you're not exercising, should someone who exercises potentially regularly pay less for their health insurance than someone? What about someone who smokes? Should they pay more? I mean, clearly we know that there's a link. So I'm not talking about genetic diseases that, obviously that's what the healthcare system is for, but where there are individual decisions that are made that lead to extra healthcare costs, shouldn't the burden, and again, I don't want to get into a political discussion, but I do think that as folks have to accept more financial responsibility for the choices that they make, whether it be smoking or poor diet or lack of exercise, I think that can help to change behavior. But at the end of the day, kind of with my opening statement, a little jaded, I don't hold out a lot of hope that that's going to happen.
I've often thought on the pricing side of healthcare, if it could work for an airline ticket, couldn't somehow it work for, by this I mean dynamic pricing? Couldn't there be an innovative model in which, I'm not saying that I would anticipate having a heart attack, that's ridiculous, but is there a way that maybe a dynamic pricing model could work in healthcare today? Because listen, let's just be straight. If it weren't for the high cost of healthcare, everybody would get it. We can't afford it. We can't afford to correct the unhealthy lifestyle or the genetic predisposition that we have, which maybe is a more interesting question. Let's get off the economics of healthcare. How about the genomic side of healthcare? So how about this? If you are I think it's My123 or Genome123, it's the Google finance company out in the Silicon Valley. You can get a test for, I believe, $99, and it will tell you with some degree of accuracy sort of what you're predisposed to have.
And actually, that's a great illustration. There is a great visionary in healthcare who I've had the opportunity to work with, Dr. Eric Topol, who is one of the thought leaders on the merger of genomics and digital health technologies. And he points out that the fundamental system in the way we do things, where doctors treat every patient the same, running the same battery of tests, and the way in which they go about trying to systematically find what the issue is for that patient is fundamentally flawed in an old model. And with genomic insights that we have, there are absolutely ways that we can target to go right to a more highly probable source of an issue for a patient. And there are a lot of really smart people who are helping to address that today.
Do you know what we're talking about with this genomic stuff? Yeah? Yeah? What?
Are you talking about
23andMe. Yeah, thank you. Yeah. I mean, so it's a test, and it with some degree of accuracy. And this is Daniel flew his question in to us with Bruce. This is a little bit on your side, and then really for the industry. Where do you want to lead the industry on your side? And then what's next for not just Valence Health, but what's next that you're going to see in the next 5 years? Because you speak of paradigm shifts. I believe we're all agreeable with that. What's going to happen, let's say, in the next 5 years in the industry?
I think ultimately, unlike in past efforts, I think this time the fundamental economic model will change, and it will probably take 5 years before it starts to really take hold. And this is the first time that I've seen all the leaders in the industry aligned around that it has to change.
When you say leaders, you mean the political, the business, the medical, the regulatory, the insurance, everybody's aligned.
Well, I don't know if they're completely aligned, but everyone agrees it's going to change. Now, exactly what the change will be and how it takes form, but I think what you'll see is a system that shifts from being a system that's based on sickness to one that begins to be focused on wellness, which is ultimately where we need to get.
This piggybacks Tori's question too. What does it take? And Bruce is answering that now. Bruce, you've had a very interesting career, and it's only getting better. What makes you get up in the morning besides being a passionate problem solver? And yes, you are an innovator, damn it. What do you want? What do you want next? You're going to stay in this job for 3 to 5 years. What do you want to squeeze out of this?
Well, at the end of the day, I want to look back on my career and say that not so much me, but the companies that I was part of made a difference in moving the needle toward where healthcare needs to be. And so that if it's my mother or my wife or my daughter who is in that bed, that there's a more sustainable system to be available and to provide better quality outcomes.
Is there an industry that healthcare needs to pattern itself after?
Well, there are a lot of analogies between healthcare and aviation, and you probably have heard the reports that came out years ago about that the number of avoidable medical errors that happen in hospitals is equivalent to one jumbo jet going down every day, and no one hears about it. I mean, there are avoidable mistakes that are made with the best of intentions that lead to people dying. And so there are a lot of analogies to checklists and the quality of air traffic control and how pilots administer. And in fact, I was just at a conference of the American Hospital Association, and the keynote speaker was Sully Sullivan, the pilot from the Miracle on the Hudson. And I can tell you that if I had to look to any other industry for healthcare to learn from, it would be aviation.
Interesting. Well, let's end on that. And thank you again for not only your insights on really a forward-thinking professional in his field, a leader in his field, but also bringing us some insights into healthcare, which is, it just is pervasive in our lives. Can't get away from it. So, Bruce, welcome back home. It's great to have you here.
Thank you for having me.
Ladies and gentlemen, Bruce Brandley. Thank you. All right, we'll take a break. Come back at 3.